We've seen a huge shift in the payment models, as I'm sure every healthcare provider has, from a fee-for-service to a more value-based reimbursement model. So now we're seeing a shift in the focus. For a long time it was EHRs and meaningful use, and we're seeing that now transition more towards let's operationalize this, let's do more cost management. So I think that's the shift in the focus that we're trying to address. So this product, TrueCost from Infor, is designed to bring many disparate data points which exist in hospital systems, like your EHRs, your supply chain, your financials, your scheduling and staffing system, all disparate systems which, while doing a great job on their own, don't necessarily talk to each other in a streamlined fashion. So that's the space we want to address. We see that as a huge gap that needs to be addressed, primarily because healthcare providers need that end-to-end view into cost, especially as ACOs and bundle payments pick up. We see that need for the true cost of a patient. What is the cost of treating a patient from the moment they enter through your primary care physician or your subacute, any other subacute facility, all the way through your acute care, rehabs, and all the way through discharge. So we want to be able to track this holistic look at cost. So that is a space we want to play in. And I think that level of automation and detail is what healthcare providers will be needing. So obviously the biggest buckets of cost in any healthcare setting is labor and supplies. These are the two biggest costs. So the product, TrueCost, is specifically addressing how to best optimize, or how to, in the most optimal fashion, deploy these resources. You have nursing staff who is taking care of a census of patients, and you have supplies that are being used for a procedure or whatever. So what is happening today is there is very limited visibility in how to best deploy these expensive and critical resources. So what we are trying to do is provide those near real-time metrics around cost, so that your operational leaders, like your nursing managers or your supply chain managers, have that near real-time information at the fingertips, so that they can make any course corrections on a regular fashion, which doesn't exist today, because there are some cost accounting products in the market which do a great job of producing reports at the end of the month, for example. But that's all retrospective data, which is great for your budgeting and planning, but not necessarily to run your operation on a day-to-day basis. So that area between the activities that are happening on a day-to-day manner and the retrospective information at the end of the month, that is the gap that has not been addressed, and that's the gap we're trying to address. So on the staff side, again, like I mentioned, with the right information at your fingertips, you can make more optimal decisions on how we best deploy your resources. So we see that helping out from the staffing perspective. Your nursing manager, for example, can be more prescriptive and intentional how he or she deploys certain skill sets of nurses to treat a certain census of patients, a certain group of patients based on their needs. So it is a lot more information, and it's more targeted, right? I mean, with the information that we can provide, now nursing managers have the ability to be very accurate, if that's the right word, to use the right staff mix based on the patient needs. So that's on the labor side. On the supply side, we see something similar. So with near real-time information at their fingertips, your supply managers can be more careful about how the resources are utilized. Is it being utilized in the right fashion? Is there maybe a more cost-effective way to do it? Things of that nature. Those are the questions we're trying to answer, again, in a more real-time fashion. I think one thing we can do is design the systems in such a way that they can be gradually brought into the process. A lot of these manual processes can be automated, but maybe if there is a carefully laid out plan where systems can be gradually brought online based on their need and the benefit, if you will, right? You could address the high ROI kind of process changes up front, and then maybe slowly bring that into the mix. As we see the shift from, like I said, into more operational cost management, We also see a need for operation leaders needing predictive information. So that way they can be more proactive in deploying the resources most optimally, right? It's good to have those real-time information at your fingertips, but also it's even better to have it well in advance so that you can plan out so much better. So like I said, the deploying the right resources, deploying the right supplies, this is what is driving cost management in healthcare settings. So that is a space we're trying to address, and it's a non-trivial exercise, right? We have all this data from disparate points. Like I said, we have EHR information, we have supply chain information, we have financials, we have scheduling and staffing, but we want to take all that information and apply some data science on it and try to distill some meaningful information that can be helpful for our healthcare providers.